So when one thinks of the word vision, how does that come to play in terms of dentistry, in terms of life? And if you don't have a vision, where do you go? What do you do? How do you do it? And then why do you do it? So when we talk about dentistry, particularly aesthetic dentistry, the vision is a primary importance to everything we do. But I'm talking it one step further. It's not just what you see. It's not just how you want to implement what you see and make it reality. It's the overall picture. It's a total commitment to making someone look and feel better. That is where dentistry is today. Dentistry has taken over many of the professionals that go ahead and do facial aesthetics and that do plastic surgery and that get involved in any kind of commitment to making change, especially a visual change. Dentistry is the quarterback of the face. It's the quarterback of health and beauty. And the only way you can go about getting involved in excellence in your craft, in your profession, in your trade, in dentistry, is to have a vision. So when I teach, when I work, when I communicate with a patient, I am looking at how they speak. I'm looking at their mouth movements, their face, their weak sides, their strong sides. And I'm saying, if I have the opportunity, if they've given me the opportunity to go ahead and transform, for example, an anti-aging smile. They'll bring in pictures of people when they were 25 years old and now they're 65 and they say, what happened? Well, it's called life. Things change. So we have a unique profession, a unique job to go ahead and bring back youth and vitality. You have to have a vision. That is a visual vision. That is a vision of what you see. And if you had the opportunity, what you would place where to give support and change. And I'll be embellishing on that pretty quickly. But what I'm saying to you is that along the way, dentists are taught to look at smiles, to look at teeth, to do what I call a smile stage, where the lips are the curtain, the scenery of the gums, and the actors of the teeth. That's one vision, and then try to implement it. The other vision is, what's happening with that patient? What's happening with the communication? What is the vision that they want for themselves, and how can I make them understand that if they allow us, if they allow the professionals, the experts, you dentists out there are all experts, they allow us to go ahead and uniquely design a palette of beautiful teeth that complement and enhance the face. That's true vision. And if the patient goes ahead and understands that if they let you be your artistic self, and if you feel confident in your role, you can implement that kind of result. So what I mean is, you have to take control. You have vision. You have a unique talent. You have to take control of what you see in order for you to make it happen. So an interpretation of vision might be artistry. You take the artistry of what you know, the individual tooth design, having a central incisor, for example, with a narrow neck, and line angles and contour that go ahead and present something that might be more masculine, more feminine, more bolder, more sublime. All these things. You can design the width of a smile that will give you lip support. You can design teeth that look younger with larger incisal embrasures. As the embrasures get larger, the teeth look younger. As we get older, we wear our teeth down and we lose those incisal embrasures. That creates the individuality of each different tooth. So as we look at the smile and we have a vision for the final result, now we have to be able to communicate that to our patient.